September 29th is World Heart Day, the biggest intervention against cardiovascular diseases. Theme 2014, Healthy Heart Environs at Home, Work, Play. Make heart choices, not hard choices. Each year, physical inactivity contributes to over 3 million preventable deaths. Blood pressure is the primary indicator. Diabetes increases risk to the heart by 50%. It's a World Heart Federation campaign, global fight against cardiovascular diseases in over 100 countries via 200 organizations. Target by 2015, reduce cardiovascular diseases-related mortality by 25%.
Hello and welcome. You watching NDTV 24/7. I'm Neha Khanna. 29th September is World Heart Day. Now, NDTV and Fortis have come together for a very special campaign, the NDTV Fortis Health4u campaign. To put it simply, through this campaign, we're asking you to take control of your health. The basic agenda of this campaign is to promote healthy living as a way of life, to raise awareness about taking health precautions and to avoid severe health problems by acting in time. Now, a major focus of this campaign will be on heart health and cardiovascular diseases. Heart attacks are catching Indians younger than ever before. Despite the information and technology overload, the average educated Indian is still ill-informed about basic health care. The need is to provide affordable and cost-effective solutions to manage the largest silent epidemic in the country. And to discuss some of those issues and to answer your queries on heart diseases in India and how these can be addressed, we are now joined by two special guests. We have with us Dr. K Bahl, Professor and Head Department of Cardiology at AIIMS. Dr. Bahl has been instrumental in drafting the national policy on non-communicable diseases. We're also joined by Dr. Sandeep Attawar, cardiac surgeon at Fortis. He, in fact, recently carried out the first mechanical heart implant successfully in North India. Dr. Bahl, let me come to you first. It has been observed over the years that the average age of an Indian having a heart attack has come down by 10 years. That seems to be pretty alarming. What are the major factors that you would attribute this to?
See, Indians get a heart attack early, they get it severely, they get it hard hit. And if you compare the data from the Western countries, in fact, a survey was conducted in 52 countries, in which the South Asian countries, especially the India, the people got a heart attack at 10 years younger than the Western population. But why do Indians get it at a younger age? That's not a completely solved puzzle, but it is maybe due to urbanization, their change in lifestyles. Younger people are having those risk factors at an early age. We have more diabetes. In fact,
we're often referred to as the diabetes capital of the world.
Yeah, that's right. And unfortunately, if the statistics go right, by 2020 or 2025, we will also have the unfortunate distinction of having a coronary artery disease capital of the world too.
Right. So are we, in that sense, sitting on a ticking time bomb, and is that something that needs to be urgently addressed? Dr. Attawar, let me take that to you. As Dr. Bahl said, maybe studies have failed to prove thus far that we as Indians are genetically more susceptible to heart conditions. But how do you think we fare compared to the rest of the world as far as cardiovascular diseases are concerned? Because it is very, very serious, the situation now.
That's right. I think adding to what Dr. Bahl had to suggest, I think the lack of physical activity is another thing that not only affects workspace, but also children back in school. I wonder whether why times have changed. When children were earlier promoted, when we were younger, we were promoted to take part in physical activity.
Right.
That has seemed to take a backstage right now. So as more and more kids are more involved with devices and with being hooked onto the internet, I think the encouragement for them to get to the playing field is significantly lesser.
Right.
I think the challenge also lies because most children have to perform in school. We have a huge population. I think we have limited opportunity as far as growing up as a career is concerned. So I think there are many societal factors that also contribute.
Hold that thought, because at this point we have our first caller. Saurabh joins us on the phone line. Saurabh, go ahead, ask your question.
Yeah, hi. Sometimes I get palpitations due to anxiety and I feel my heart is beating very fast. I've been facing this problem for around 6 months. My echo and stress echo tests are absolutely normal. Is there any reason to worry about my heart?
If echo and TMT is normal, so basically they have excluded coronary artery disease, they have excluded that valves are normal, heart function is normal. The only thing needs to be excluded is arrhythmia, some form of abnormal heartbeats. So if heartbeats occur suddenly fast, it may be due to various reasons. The simplest test will be if he gets a ECG done when he has the palpitation, or not. There are other modalities available which we call the Holter monitoring. We can put a small tape recorder sort of thing in the chest, outside the chest, and it can record the heartbeat for 24 hours or 48 hours, or even there are longer monitoring devices available which can monitor for months. And during that episode we can diagnose what he is suffering from.
So in fact this takes me to my next question, which we got from a viewer online. We have a question from Radha from Pune. She's 28 years of age. Dr. Attawar, if you could take this. She says, what age do you recommend people should have their first routine heart checkup? That is perhaps a question that a lot of us ask ourselves.
That's right. I think there are a couple of things here. What is very important is you first must have a fair idea whether you have heart disease in your family. Do you have diabetes in your family? Do you have hypertension in your family? Then you look at your own lifestyle. If you have any of these non-modifiable risk factors which we just spoke about, genetics and probably other issues, you look at whether you have modifiable risk factors. Some of us do smoke, some of us obviously eat a lot of junk food, we're not very careful with what we do. We have a serious lack of physical activity, we are sometimes obese. So if all these things come together, then you can actually consult a physician and he will possibly be able to strategize whether what are the right kind of tests that you would require, and whether you certainly have a risk for heart disease. For example, if you have a parent who has heart disease or who is diabetic or hypertensive, you automatically fall into...
So if it runs in the family, then you've got to be that much more careful and proactive in getting yourself tested at perhaps even an early age, because times are changing. In fact, we have another web question from a viewer, Francis Pinto from Chennai. He's 60 years old. He writes saying, I had undergone a bypass surgery 6 months ago. I have been prescribed Metolar 25 mg, Ecospirin 75 mg, and Atorlip 10 mg. I have read that prolonged use of Ecospirin and Atorlip can affect the body over a period of time. I have been told I should continue this almost lifelong. Can I continue with this medication without ill effects? My BP, sugar and cholesterol tests 3 months ago were normal. Also, is a low salt, less oil, coconut and once a week chicken diet okay? Would both of you want to take that one by one?
It's a long question, but what one should understand is the bypass surgery or an angioplasty or stenting is not the end of the story. So even if you have a bypass surgery done, the same precautions which we call now the secondary prevention have to be continued. You have to continue walking, you have to continue taking care of your diet, continue to check your weight, don't smoke if you are smoking, have your medications regularly. As he was mentioning, most of the heart medications are tested for lifelong use. The statins are very good. In very small percentage of patients it can lead to a rise in liver enzymes or some myopathy. If he has tolerated it so long, I think it will do a lot of good to him if he continues with these medications. So all the 3 medications he suggested, except for the beta blockers, the statins or the aspirin as recommended.
We have an interesting question from a viewer called Vishal. He writes in from Gurgaon. He's 35 years old and he says, deadlines, odd work hours and stress. Everyone in my generation is facing the same and is graying and aging faster. The usual advice is to exercise and eat healthy. What is eating healthy when you barely have enough time to chew your food properly during office hours? Now, I can tell you that this is something that I can perhaps directly relate to, and many of us indeed can. So how would you address a question like that? Dr. Bahl, if you could go first.
See, when we advise diet, we advise a healthy diet. We don't say don't fast, don't feast. That's a simple advice. So whatever you are eating, eat healthy. At least 4 or 5 servings of green leafy vegetables, fruits. If you are using, say you are non-vegetarian, you can use the white of the egg. You don't use the yellow which contains cholesterol. If you want to use chicken or the fish instead of red meat.
Dr. Attawar, if I could take that to you.
Yeah, I guess, I mean, continuing with the answer, I think priorities are important. I don't think it is absolutely some kind of deadline that one can't meet if he puts a plan in place. Health, I think there is no easy answer to being to keep healthy.
Right.
I think a proper amount of sleep, the right kind of diet, and a reasonable amount of exercise, some probably some meditation to go with it, and eating the right kind of food, as Dr. Bahl put it. I think it's not easy. It's an effort that you need to put over years in order to reap benefits when you're older. You know, because then you have aging joints, you have
Right.
weakening liver,
Okay.
you have a kidney that is obviously supposed to stay with you all your life. I mean,
Right.
all these things do affect the rest of your body, not just your heart.
All right. Now, we have another interesting question from a writer, Ruchika. She's 34 years old. She writes in from Jaipur. And she asks, are there any benefits of being a vegetarian? Am I less susceptible to developing a heart problem as a vegetarian? Is that just a myth, or is there any element of truth in that? Does being a non-vegetarian put you at a greater risk compared to vegetarians?
Yeah, probably the kind of food that you eat. I mean, if you obviously like deep fried stuff, you end up eating chicken which is deep fried. You eat parts of the chicken which are laden with cholesterol.
Right.
Yes, certainly. I mean, you have a tendency to consume, not just meat, but probably pieces of liver and things like that. Yes, you are succumbing to heart disease very,
So
very
you do
early
tend
on.
to be a little more susceptible.
Yes, I think so.
All right. On that note, we'll slip into a short break, but when we come back, we're going to talk about how susceptible women are to heart conditions. Stay with us. Welcome back. Well, we're still talking about what you can do to take charge of your health. Okay, now, Dr. Attawar, let me come to you. We want to talk about women a little bit. Is it a myth to say that women are less susceptible to heart diseases compared to men? Or could it be that perhaps because they have to deal with the pressures of both home and work, it's perhaps a little worse in their case?
Yes, absolutely, because I think women premenopausal and women postmenopausal are two different individuals altogether. Estrogen has a protective effect on women and their health as far as cardiovascular status is concerned. However, postmenopausal, their risk is more than males of the same age.
Okay.
So that's a serious matter. Women also tend to have symptoms that are not very classical as far as presentation is concerned. Women also have these pressures of being mothers, sisters, and
Right.
working women. So obviously, all these things
All
together.
right.
Yeah.
So certainly it's something that needs to be taken seriously. We have a call coming in at this moment from Pragati. Pragati, go ahead with your question.
Yeah. Hi, my sister is 5 months pregnant. So are there any precautions that she needs to take to ensure that the child has a healthy heart?
Dr. Bahl, if you could take that.
Yeah, if 5 months, we don't take anything which is not prescribed. Some of the medicines can be harmful, especially in the first 3 months of pregnancy. Have your blood pressure checked up, because that's very important. Some people develop hypertension when they become pregnant. If she has a previously checkup done and she has no valve problem, the blood pressure was normal, the heart was okay, the pregnancy wise the fetus should be safe if she has not have any viral infection during the first 3 months. So these are the simple causes which can lead to some of the congenital heart diseases, like viral infection the first 3 months, taking some medications which are harmful to the fetus, or having a high blood pressure. These are 3 important causes.
All right. Dr. Attawar, if we could shift tracks a little bit and focus on heart transplants. It's a very, very complex subject. We'd perhaps need much more time to discuss it in great detail. But you recently carried out North India's first successful mechanical heart transplant, if I may put it that way. How much of a problem do you think this gap between the demand and supply of such vital organs really is, especially when it comes to heart disease?
Huge. I think it is huge. We are talking about a system that is so well coordinated, which is in the United States. They need 50,000 hearts a year. They get probably 2,000 of them, or maybe 2,500. So we do not even have a system in place, and we have a population that is 10 times larger. So we are looking at an enormous health crisis. It's not that we have lesser heart failure here. We do. An estimation probably would be 500,000 patients requiring some kind of advanced treatment for heart failure, and there is almost none. Like Dr. Bahl quoted earlier, just 100 heart transplants in the last 20 years. I think there is a serious problem.
So a lot that needs to be done. In fact, at this point, let me take another question that has come to us online from one of our viewers. Rajan from Amritsar writes, I'm 40 years old and got a DES stent implanted 15 months back to prop open my LAD that was blocked to 80%. I feel chest tightness daily. It is mainly near the clavicle bone area on the left side. I feel uncomfortable when I walk. Exertion brings tightness, no shortness of breath, no BP problem, cholesterol ratio is fine, no sugar. My cardio says pain is muscular. Please give your opinion. Would you want to quickly take that?
Probably ask him to get a treadmill test done once again. First check his blood pressure. If good, go for a treadmill test. And if that obviously is clean, then maybe at least seek consultation with the cardiologist just to make sure that everything's fine.
All right. At this point, let me move on to another important aspect that we want to focus on. Another focus of the NDTV Fortis Health4u campaign will be on the importance of having a public that is trained in CPR, cardiopulmonary resuscitation. Now, it is a documented fact that receiving basic life support in the critical first minutes after a heart attack can mean the difference between life and death. Let me, in fact, take that question to Dr. Bahl. Dr. Bahl, in many countries, especially in the West, we have seen that CPR is a part of basic training that's imparted to school children. Do you think it's time it became a part of curriculum for school children in India? And what is the right age when you think this kind of training can begin?
Yeah, the education should start from the schools. It's not that in India the efforts are not being done. Like police personnel, the people who are paramedicals are taught these CPR techniques. So one is a basic CPR which is taught to the people who are lay public. So if you are a bystander and happen to see a patient with cardiac arrest, do that basic till the help arrives. And one is the advanced CPR. You must have seen in the airports now AEDs are being implanted. These are defibrillators. When the arrest occurs, you give a shock and the heart can come back to normal.
All right, we seem to be running out of time now. As we bring this discussion to a close, let me take quick closing comments from our two guests. Dr. Bahl, let me come to you first. Growing incidence of cardiovascular diseases in India is clearly a concern. What would your most basic prescription be?
See, prevention, prevention and prevention. We can't take care of this large population by treatment alone.
Dr. Attawar, if I could take that to you. You know, like I said earlier, a lot of our viewers who've been writing in say there is so much talk about a change of lifestyle. But what exactly does it mean and how practical is it? Because it is felt, especially by a lot of young people who lead stressful, hectic work lives, that perhaps a lot of steps that are recommended may not be completely practical. What would your advice be?
Yeah, I guess, I mean, there's nothing really much that I can add to this. I think it has to come from within you. What is very important is we see many people towards their retirement age. You see them walking in the park almost very religiously, very regularly. The question is whether they have been doing it before, you know. So I guess we take a cue from many of them, and I think we just start changing our lives.
Start changing our lives bit by bit. I guess that's what really makes all the difference. On that note, I'd like to thank Dr. Attawar and Dr. Bahl for joining us and answering all those questions. Well, as part of this campaign, CPR camps are being held in 7 cities on the 29th of September. That's World Heart Day. You can log on to ndtv.com, Health4u, to register yourself or your organization for a free training camp. So join us on the 29th World Heart Day as we hold free camps in your cities. Well, remember, steps towards a healthy life involve small adjustments, not drastic measures. The NDTV Fortis Health4u campaign does just that. So make that little bit of extra effort and stay healthy and stay safe. Thanks so much for watching.